Today, we will practice dental eviction, a rabbit premolar. And it begins! Now, I use a combination of ketamine and acepromazine, which will give maximum anesthesia after 7 minutes. In the meantime, I prepare the equipment I'll need for the operation. In order to see it correctly, I use a headlamp and a pair of glasses with the only focal point that will allow me to see perfect and horizontal. This intervention is necessary because the rabbit has a problem. The upper molar don't grow anymore. The lower premolar has no longer an antagonist. And that the teeth grow by about 2 millimeters per month. The lower premolar has grown into the soft palate and interferes with mastication. This technique will get rid of the problem, which take off in a definitive way. The equipment is ready. We can see the incisors, which are tilted because of the mastication problem at the back of the mouth. Everything is ready, we can start. We place the rabbit flat on its stomach, head towards the operator. The assistant will hold the rabbit during the intervention. The headlamp is on. The operator will be able to begin. We first place the mouth opener, which will keep the mouth open throughout the procedure. Be careful not to open the mouth too wide, otherwise there's a risk of fracturing the jaw. The assistant will keep the mouth opener step so that the rabbit's head stays well horizontally throughout the operation. In the small window at the top right, you can see what you're doing inside on a rabbit skull. It is very difficult to visualize inside the mouth during the surgery. Here I put a side cheek spreader which allows to visualize well inside of the mouth. We use foam pliers that do not hurt the tongue. Crossley syndesmotome is used. This syndesmotome has 2 zones, an area longitudinal and an area perpendicular. Make small movements, cut first the front, then the back, then the lateral ligaments. And then with small laterac movements, we will cut the intermediary ligaments. You have to be very meticulous. Be very patient until the tooth is mobile. Look up and to the right, so you get the details of what's going on inside. The operation is filmed in real time, slightly accelerated. When you look at the mold, the length of the premolars, we see that they flush the bottom of the mandible. It is therefore necessary to sink gradually the syndesmotome until the tooth is mobile. The tooth must be mobile. As long as it is not moving, it is out of the question. To move on to the next step, it's not good yet. We continue by reversing when necessary the positioning of the instrument, either one end or the other end. In order to cut these ligaments, you must pass the syndesmotome all around the tooth. Hence these small lateral movements that we see that I do with my hand. A little verification will be necessary. Here I'm sticking my tongue a little. Let's see. The tooth is not mobile enough. A little more work and we'll have solved our little problem. It's looking good. It can be seen that the lateral movements are gradually a little wider than at the beginning. We do a little check in there, starts to move a little. We take advantage of this opportunity to mop up a little one. Fire with a homemade cotton swab without stick, polluting the planet. This technique allows us to remove molars and premolars. But we must practice in the sense of the order of teeth, from front to back. But today we only have one, withdrawn. I take advantage of this moment to talk about dental evictions. The jaw teeth grow about 2 millimeters per month. And this is something that it can be rebalanced. A checkup after 2 months is required for our case. I think the eviction that we do today will solve the problem, definitely. I'm pretty optimistic. Tooth growth is fluctuating, so it still needs to be controlled. I control them systematically. Before each annual vaccination, it's okay, we can move on to the Crossley David. Note its special form. It is perfectly adapted to the mouth of rabbits. At first, I do some small lateral movements in order to break the last ligaments that still hold the tooth. Once this is done, I press the clamp to my thumb. This will allow us to make a traction in the growth direction of the tooth. Here is the tooth. Withdrawn, the operation is over. Cleaning and checking of other teeth. For this rabbit, everything is perfect. We will be able to let him now awakening, by the way. In post-surgery, we use a painkiller, an anti-inflammatory, and an antibiotic to prevent infection and secondary complication. Now, the young man will be able to wake up. More surgery videos are here.